Welcome to the Psych Sofa, University of South Wales podcast on how psychology can change lives and the world for the better. My name is Dr Klara Price, and on the sofa today we have Professor Bev John and Professor Gareth Roderique-Davies, co-founders of the Addictions Research Group at the university. Today we will talk about how Bev's and Gareth's research impacts public health policy and treatment. Bev and Gaz, thank you and welcome to this podcast.
Thank you.
Hello.
So my first question is about the Addictions Research Group. So how did the idea of setting up this Addictions Research Group come about?
We've both been working in various areas of addiction for many years, mostly in alcohol and Gareth more in other drugs. And in 2015, we went to a research meeting organised by Public Health Wales, and they were talking about alcohol-related brain damage as a condition that they were increasingly concerned about, but there seemed to be no research in that, or very little research on who gets it, sort of how much alcohol, for example, you might have to drink to be at risk, or how many people are suffering from this condition. So we left there and we thought, okay, we're going to find out. And just after that, we secured a little bit of money from the university, who invested in the group, to appoint a research assistant to help us start exploring this area and just, start working out what was happening with alcohol-related brain damage. And we sat in my office one day and we said, do you know what? We're an addictions research group. And that was how it all began.
Yeah, hence it was born. It was the three of us sat in Bev's office, ourselves and a graduate of ours, a guy called Rob Hareen, who's now off in Australia doing great things.
So what exactly is alcohol-related brain damage?
It's a spectrum of conditions caused by chronic alcohol use. So there are a number of medical conditions that can be caused by chronic alcohol use. Broadly speaking, they all result in memory problems. There can also be problems with aggressive behaviour. There can be problems with coordination. But each of these conditions has as at its core chronic and excessive alcohol use over a period of time. And what was being noticed by people working in homelessness services, in clinical services, was that there was enough people who were exhibiting signs of problems, memory problems, that could be considered to be related to their alcohol use. And so that being the case, then really we should be aware of it and do something about it. But when Public Health Wales were looking at the evidence of it and what to do about it, there really wasn't that much evidence there. So how you diagnose it, what it actually is, and how many people have it, that's the sort of information that we needed to clarify. So that's where we started the research.
So going back in time, so you sat in your office and you decided, right, now we're a addictions research group. What happened next?
Well, we secured some external funding, so some money to pay for Rob Hareen to do a PhD in alcohol-related brain damage. So then we got another research assistant, as well as additional PhD students. So it sort of started to grow, and other colleagues within the psychology department, who were interested in extreme sports, for example, started to sort of get involved with our group as well. We had some contact from the Welsh Senedd, from the Welsh Government, from Senedd members who wanted to know if we would conduct some research into gambling-related harm for them, because they were interested in the sorts of health harms of excessive gambling in Wales. So we got another research assistant to help us with that, another one of our graduates, and started doing work on gambling as well, and the sort of public health aspects of gambling-related harm. And as a result of that, we got invited to Westminster to give evidence to, not the Queen, to give evidence to an all-party group of MPs in Parliament on our research findings in relation to that. So things develop, in quite an exciting way. Once you think and you think, right, we're going to do this, and then other things often come of that, of just saying yes to people, really. So that's one of our mottos, isn't it?
Yeah, just say yes. And a lot of this is working with external people within public health, people within third sector charity organisations, people in Welsh Government. And what we found is, obviously we were doing research in alcohol-related brain damage and we were doing research in gambling as well, but a lot of the people involved in both of those worlds overlapped. So we were able to make connections that benefited our ARBD research through doing the gambling research as well. So our connection with the Royal College of Psychiatrists, for example, came about through our gambling research, but they ended up endorsing our alcohol-related brain damage research. So it's all about making external connections, doing things that people are, see are of benefit to the real world. And, it's exciting and interesting to do it.
So what are some of the current projects that you are both working on at the moment?
In terms of alcohol-related brain damage, which is sort of a lot of our current focus, and we have 2 PhD students at the moment working on different aspects of early identification of people who may have alcohol-related brain damage. So if they can be identified early enough, because I suppose an important, just quick point is that alcohol-related brain damage is reversible to some extent for some people. It's not like dementia and other progressive problems that perhaps, can't be reversed. So it's really important to identify as early as possible in order to step in and help people. So part of what we're doing at the moment is rolling out some training that we've developed based on our research findings over the years, which is for health and care professionals initially across Wales, but across the UK. We're expanding it across the UK and potentially further. We're sort of currently hearing about people in Australia who may be interested. So that's one big element of what we're doing at the moment. So sort of influencing practice in that sort of way.
So you've obviously made a lot of connections with external bodies and Welsh Government and public health ways. So where do you start? How do you make these connections?
Yeah, it comes back to saying yes and make just talking to people. And I had previous involvement with a third sector organisation that worked with people who were at risk of homelessness. So I had an in with them, but they were very interested in the ARBD research, and they ended up co-funding the PhD. It was initially Public Health Wales who raised it as an issue and wanted people to look into it. So, we were able to get in touch with them and say, well, look, we're gathering the evidence. And that led to them developing a treatment framework for the Welsh Government. So, we were invited to be part of that. Alongside that, we were working with NHS clinicians who were, on the front line in substance misuse services, working with individuals. And through writing the treatment framework, we were able to make connections with them and to progress some of their research ideas as well. And we formalised links with them as well. So one of our contacts within Gwent is a visiting professor at the university now, and we work very, very closely with her. So having conversations, saying yes to people, and I think the important thing is doing research that people see the benefit of, that there's a need for it, and that people want to know about it, and that changes can occur if you've built the evidence base around something. So the evidence-based informed the treatment framework. The primary recommendation of the treatment framework is that we need to increase understanding and just raise the awareness of alcohol-related brain damage. So that's then where the training comes in. So we're satisfying the first recommendation of the treatment framework, whilst also looking at all of the other recommendations around diagnostic criteria and treatment pathways, and trying to work towards standardising those, not only within Wales, where we have devolved health, so we can look after how we look into health within Wales, but if we can standardise these things within Wales, what we've learned is that other nations of the UK and beyond are looking at what Wales are doing to take the lead on how they should also be addressing this issue. So say yes. People, doors are open. People want to hear about the research that's being done, and just don't be afraid to go out there and talk to people.
You've mentioned the treatment framework, so could you please tell us a little bit more about that?
Yeah, absolutely. So the Welsh Government published a substance misuse delivery plan. So what they plan on a cyclical basis over so many years, what their priorities are going to be and how they're going to go about addressing those priorities. And one of the things they had put within that delivery plan was to put together a treatment framework for ARBD. So that document was put together by ourselves and clinicians and other academics and people from Public Health Wales. And the idea behind it is to start to give an indication of how individuals identified as having alcohol-related brain damage should be treated, in effect. And it's recognising that it's a complicated problem, that individuals are likely to show up within charity organisations, within clinical settings, within a whole range of settings. And if they are identified, what happens to them? Where do they go? Who do they get referred to? What sort of processes should they go through in order to firstly establish that they do have alcohol-related brain damage? And then if they do have alcohol-related brain damage, what those pathways are in terms of being able to help and intervene. So it's formalising a structure to be able to intervene on what is, a serious but actually preventable/reversible problem.
Obviously very impactful work that you're both involved in, so thank you very much for sharing. And is there anything else that you would like to add to this conversation today?
It's fun.
Yeah.
I think that's important. I think we've always said that research is a team sport. So, we've worked together very closely for a number of years, but it's great that we've had other colleagues sort of come and join us and do certain things. And also students as well. I think it's quite important. We have a number of sort of recent graduates who've worked with us, but also sort of MSc students can, do their dissertations with us and as part of our external projects with other partners as well. So when we've sort of been looking at, say, alcohol and gambling to get, the sort of problem co-occurring, which is something that obviously happens, then we've had master's students helping us collect data, sort of exploring these sorts of things for one of our external partners. So, it's the more the merrier, really, as far as we're concerned, I think.
Yeah, I think the focus of the topic is obviously serious, but the undertaking of the research, the connections, the interacting with people, it should be fun and enjoyable. And, that's the sort of atmosphere we like to try and create around it.
Thank you very much, both. It's been lovely chatting to you today.
Well, thank you for talking to us.
And next on the sofa, we have Dr. Darren Quelch, a senior lecturer for the Addictions Research Group. Welcome to the podcast, Darren.
Hi, Klara. Thanks for having me.
So my first question is, how did you get into working for the Addictions Research Group at the university?
I've worked with Gareth and Bev now for just under 2 years, and I came from an anaesthetics training post. So I was working as a doctor in a hospital near Newport. I was training to be an anaesthetist, and I'd done lots of different roles before then. So working as a respiratory doctor, as a junior doctor in respiratory wards, on surgical wards and intensive care. And I think I was getting to the point where I wanted a change. I had done some research before, and I was really passionate about it. I worked in another addictions research group. So it was a group in Imperial College where I did my PhD, and I really loved what I used to do, and I loved the freedom and the amount you get to be a nerd. And I think I missed that a little bit from medical practice. And I saw the job advertisement, and it was near my house and with an excellent group, and I thought, right, I'm going to go for it. And whilst I didn't tick many of the boxes, I ticked some other boxes, I guess, that were in Gareth and Bev's head. So yeah, here I am 2 years later, and I'm hopefully not going anywhere anytime soon.
Fantastic. Okay, so what are some of the current projects that you are working on?
A lot of the work we do, or that I'm focused on, is around alcohol dependence and alcohol addiction, and then a condition known as alcohol-related brain damage. So I guess the main reason I got here was working on a training package for alcohol-related brain damage for healthcare professionals. This is kind of a response to the Welsh Government Substance Misuse Treatment Framework for ARBD that Gareth and Bev co-wrote. And within that, there's recommendations around raising awareness and through the development of a training package. So I've developed the content for some of Tier 1 and all of Tier 2. And that's now available through our commercial services enterprise. And yeah, so one of the projects, I guess, is all about raising awareness of alcohol-related brain damage, but also trying to explore other avenues to improve care and services for alcohol-related brain damage. So I work with an alcohol care team in Sandwell and West Birmingham NHS Trust, and they provide frontline care in acute services for people presenting with alcohol-related health problems. So that's from intoxication all the way through to the scary conditions of alcohol withdrawal, where people can have seizures and things. I've got one project going on with them, but I've got another one where I'm working with them to map services surrounding alcohol-related brain damage across the country. So there's a national survey that's available where we're asking healthcare providers to fill it in and tell us what they're doing for people with alcohol-related brain damage. And actually, part of some of the most important findings is that people aren't able to do anything, and an absence of information actually is quite powerful in this setting, because it gives us kind of ammunition almost to present this to people, that there is a huge problem and a huge lack of services and a huge need for services, but currently not much being done. That's some of the work that I'm doing with the team in Birmingham. And then the rest is kind of a bigger project around the importance of alcohol care teams and some of the preventative work and some of the really important work that they can do in frontline services. The alcohol care team is a group of specialists. They have an expertise around management of lots of alcohol-related health problems. And part of my job is to I'm coming in and I'm evaluating some of their services. So looking at avoidance of admission, for example. So people presenting to acute services with alcohol withdrawal is really scary. It's a very dangerous condition. And like I said, people can have seizures, and unfortunately it carries a high risk of death. But it's a treatable and avoidable condition. And often what happens is that people get admitted into hospital because it's a safe place and you can manage the symptoms. But unfortunately, what comes with that, when there's no planning around the admission, is that people come into hospital, they stay for a long period of time, they're given lots of medications, but they're often not given much support around their drinking, or they're not given any advice about reductions in drinking or how to reduce things safely. And so a lot of the time they're discharged back to home or to, wherever they came from sometimes. And that leads to readmissions and repeat withdrawals. And we know from the literature that the more withdrawals you have, the more severe your withdrawals become. So the more likely you are to have seizures and the worse your long-term outcomes are. And part of the role of the alcohol care team in Birmingham in particular is about avoiding that acute admission. And that has a number of benefits. So it means that people don't end up going through these repeat cycles. So sometimes they might just be given advice about, okay, so now you are experiencing some symptoms of not having alcohol in your system. But if you were to reduce your alcohol intake in this structured way, and by all means go home and have a drink to reduce your symptoms. And the benefit of this team is that they will see them either over the phone or in an outpatient appointment within 24 hours. So it's a really structured and supported way of discharging people safely. So this reduces unplanned admissions, which is of benefit to the patients long term, but also really useful for hospitals because lengthy admissions and repeat admissions are, as I'm sure you know, very expensive. They use a lot of resources, and long term, it means that if we're avoiding admissions for alcohol dependence and withdrawal, those resources might be able to be diverted to other at-risk groups, and pressures on NHS services are just extreme. So that's one of the things, in a roundabout way, that I'm doing with the team in Birmingham. Yeah, they've got so much interesting stuff going on, and I could probably wax lyrical about it forever. But yeah, so that's one of the things that I'm doing with them.
Would you like to tell us a little bit more about the other project, maybe, or the other thing?
Yeah.
You mentioned that was one aspect of your work, obviously, and there are many others. So would you like to tell us a little bit more about any other aspect of your work?
So I guess some of the other work that I'm doing with the team is about evaluating a novel intervention that they've got in accident and emergency. So the alcohol care team, when they go out and review people in A&E, they will assess them and make lots of recommendations around their care to the healthcare professionals that are looking after them. So the A&E doctors, the acute medical doctors, etc. And we're evaluating that with a view to applying for further funding so that we can do this in a more robust and systematic way through the performance of a randomized controlled trial. So currently I'm looking at the retrospective data, so data that's already been collected, and looking at whether this intervention they've got in Birmingham reduces admission, whether it reduces the length of stay in accident and emergency, whether it's associated with a reduction in seizures or delirium tremens, which is another scary presentation associated with withdrawal. So hopefully we can gather enough information from this to say that this intervention is really effective and it is worth investing in and worth doing in a more robust way, because the problems with looking at data that's already collected in a really busy hospital, working with populations that are sometimes a bit haphazard and your collection of data is sometimes a bit skewed, is that there are holes. And the benefit of doing it prospectively, so looking forward, is that you can have more control over the data that's collected, and it will be more robust. So we can then say to people more broadly across the country and internationally, this intervention really works. It helps the hospital, it helps the health service, but importantly, it leads to patient benefit as well. So that's my overall goal for that project. And actually, I think it's doable. It's I think people are really interested in it. It's applicable and it's kind of topical. So I think there's no reason why I shouldn't think it won't happen. And I'm very positive that we'll get some money to do it in a more robust way, because I think it's absolutely worth investing in.
So is there anything else you would like to add to this conversation today?
I think I've obviously come to this group in kind of a weird and roundabout way, because I guess I do have that kind of imposter syndrome of not being a psychologist in a very psychology heavy group. I'm in the Department of Psychology, but it's been such a refreshing environment to work in, and I can kind of see the benefit of this multidisciplinary thinking and team that I actively work in, but I also work with in the NHS settings, and how that leads to health improvement. And Gareth and Bev have been a prime example of that for me. They've developed evidence-based healthcare recommendations that are now going full circle and we're able to implement, and they should be implementable and practicable and translatable to loads of settings. So yeah, I'm learning, you feel like you get into a point where you know stuff, and then you're like, actually, there's quite a lot more to learn. And well, I hope that doesn't stop, because I'm, like I've said a few times, I'm a complete nerd. So I would be bored, I think, if I wasn't. So I think that's it. Thank you for having me.
Thank you. It's been really lovely chatting to you today. Thank you very much,
Klara.
Darren. Thank you for listening, and thank you our guests, Professor Bev John, Professor Gareth Roderique-Davies and Dr Darren Quelch. To find out more about this podcast and our work, search USW Psychology.